Welcome, welcome, welcome everyone. I'm really glad and excited to see such a great turnout today for our report out on our Rapid Improvement event. My name is Dr. Chris Farnetano. We have a team who's been working here all week long, and they're really excited to share with you all the great work that they've been doing to improve the health care for our detention patients. How did we get to this point today? Well, a few months ago, we started with what we call a value stream mapping event. We spent a week really deeply trying to understand how we deliver health care to people in our detention facilities, and understanding the good, the bad, the ugly, the delays, the obstacles, and then envisioning a better future state where the care would be delivered in a better, seamlessly, more improved way, and laid out in detail how that would look. All along, our guiding principles throughout this process were the three key words: dignity, privacy, and safety. And we focused on that all along. Some of us had to learn a new language. Some of us were new to the detention setting. We struggled with the term inmate versus patients, and after listening to the patients, we really heard loud and clear that they did not want to be referred to just as an inmate and just by whatever crime they were charged with, but they wanted the health staff to think of them as patients and as individuals. And so we really made a conscious effort to talk about them as patients. During this process, all of us really developed a deep respect for everyone that lives or works in a detention setting: the custody staff, the health staff, and our detention patients. So after this value stream map, we developed a driver diagram. What a driver diagram is looking at what are the key interventions that would move forward to an improved outcome. And we looked at the primary drivers, the key things that would make a difference, and then the secondary drivers that fed into those primary drivers, and then specific identified actions that would help drive both the secondary and primary drivers towards our key aim. And what was our key aim? Well, we summed it up as one care. Providing high-quality care for patients that addresses all their mental, physical, and psychosocial needs, and is timely, trauma-informed, and culturally sensitive and respectful. And this care is regardless of the setting in which we are providing that care, whether it's a detention setting or a non-detention setting. So we then planned out a series of rapid improvement events, week-long events focusing on different aspects of the care. We'd already completed a rapid improvement event focused on our intake process in detention. We had another rapid improvement event focused on the emergent level of care, especially mental health crises and emergent mental health care. And then that brings us to this week, where we were focusing on specialty care and therapeutic groups. So why a whole week focused on specialty care and groups? Well, we realize there are waiting lists for certain high-demand services such as dentistry and optometry. And providing specialty care in detention is really complex. Much of the specialty care is actually delivered at our Martinez Health Center across town on the Contra Costa Regional Medical Center campus. There's complex logistics around transporting detention patients from the detention facilities, which are multiple facilities across the county, over to get them to their appointment on time in a secure manner. We also realized we had an opportunity that presented ourselves because there was increased custody staffing over the past year in our medical module at the Martinez detention facility, and that gave us an opportunity to schedule more therapeutic groups. And we wanted to really take advantage of that opportunity. So we started by really trying to understand the entire process around specialty care, from when the specialty care is first requested and it's identified that the patient needs a specialty care, to after the care is delivered and the patient returns to their housing unit.
Good morning. My name is Roberto Vargas. I'm the Director of Safety and Performance Improvement and one of the team leaders for this week. So we completed this week's activities and tests through the PDSA cycle. As we came up with ideas to test, we defined those tests further through planning, that's the P, the do, so we would conduct those tests and then study those tests and analyze the results. As we understand the results, we would make decisions and act on those. We had a few decisions ahead of us, whether it was to adapt, meaning the results were the outcome that we wanted, and so we installed those or tested those further. We would adopt, meaning that we liked exactly what happened, and we would move to the phase of sustainability or maybe spread phase, and then we would maybe abandon, and that would include that the result wasn't what we were looking for, or the result we felt didn't really add to the contribution of the overall goal. Over the last several weeks, it's been really exciting to watch this team grow. This is our rapid improvement number 3, and I felt like we've moved from a team of, or a group of individuals to a thoughtful team of improvers with rigor that is really building in sustainable change. And so this week, we broke up into 3 separate sub-teams to complete this week's work. We have a access and capability team, a scheduling and transportation team, and then a therapeutics group team. And you'll hear from those now.
Good morning. I'm Julie Kelly, and I am a clinical consultant for Contra Costa Detention Health. So I had the honor of being on the access and capacity team. So what does that mean? We looked at specialty services for inmate patients and how we can improve our access to those appointments and how we can decrease wait time. Specialty appointments are difficult in the community, and they're no less difficult in detention because of the added complexity of having to transport inmates and having to figure out how to make sure that all the coordination is done in terms of transportation, what the patients need, and to make sure that they don't overlap with already urgent patient needs. When we reviewed the data, we determined that there were several specialty referrals that were in demand in detention in particular. We looked at optometry, which was the highest demand, and that was, we currently have 4 to 5 referrals a week in detention. The second runner-up is ophthalmology, with 2 referrals a week. Orthopedics with 3.5, and physical and occupational therapy with 2 referrals a week. What that means is we have those specialties are not offered currently in the detention facility, so how do we make sure that those appointments, that need can be met in our community clinics in Martinez?
Good morning. My name is Valerie Gordon. I am an RN, and I am assigned case managing duties in detention. After looking at the data, we looked at causes of delay. The first one would be difficulty coordinating available appointments with the transportation unit. Another was insufficiencies in the detention dental clinic. We looked at what we could do better to improve those appointments. Another area was inadequate staffing to schedule appointments, and then unclear authorization processes or workflow for getting services or getting specialty appointments and outside the county facility. I would just point out and emphasize that once patients come into jail, they lose or they're not able to access their existing medical insurance.
Good morning. I'm Pamela Peacock. I'm the lead registered dental assistant for ambulatory care and jail facilities. Currently, right now, the dentistry is in high demand at the detention facility. Current operations are not able to keep up with the highest demand. At Martinez Detention Facility, there's 34 patients on the waiting list, and there's approximately 75 at West County Detention Facility. This demand increases daily by 10 additional referrals to the dental clinics.
Good morning. Thank you all for being here. My name is Jessica Hamilton. I'm the lead physician for Detention Health Services. And as Pam stated, dental services experience one of the highest demands with approximately 50 referrals per week. Julie went through some of the top external referrals that we do, so opportunities to send our patients to the greater county system. And because dental is one of the highest demands, we actually brought that service into the facilities many, many years ago. So to look at some of the areas for improvement, we went to the place where care is delivered and we observed the dental clinic and the workflow and looked for just root causes to identify root causes of our inability to meet our demand. Detention Health Services is really fortunate to be part of the greater county system, and we saw many opportunities to adopt some of the proven systems that work within the county health systems, health centers. So some of the ideas that we had included streamlining the scheduling process, standardizing our equipment, replenishing necessary non-functioning equipment, and simplifying our medication administration workflow. And while these improvements will greatly increase our capacity and our ability to meet our demand, we still think there will be a need for increased provider time and increased clinics within the facilities.
Hi, I'm Gabriella Sullivan. I'm the Specialty Medical Director for the hospital and health centers. And as you heard from my colleagues here, Julie Kelly, optometry is a very high demand area. And patient inmates can only go to Martinez to get this service, whereas other patients can access approximately 30 to 40 optometrists in the area. Inmates can only go to Martinez. So we have reserved an entire clinic at Martinez for patient inmates once a week. So this will really, really help to improve access in this area. We've also reserved 2 clinic slots in ophthalmology for inmates, and we are working in other areas, for example, GI procedures. Again, patient inmates can only go to Martinez for their procedures, and other folks have other access to other GI doctors. So we're working with other impacted services and more to come. Thank you.
Hi, my name is Mabel Stone. I am a charge nurse at the West County Detention Facility in Richmond. And as mentioned before by Val, one of the causes of delays for specialty services is the financial aspect of it, the authorization. And so during this week, what we did was we mapped out our processes for requesting authorizations. And as you guys know, we do have federal inmate patients and we have our county inmate patients. And as we reviewed our processes, we realized that as far as the federal, it's very straightforward. We don't really have a lot of delays there. However, for our county inmate patients, and especially for the non-county health facility referrals, like for example, someone who would need a service that we don't offer here and might need to be seen at UCSF, we discovered certain areas in our workflow where there's a lot of back and forth between the detention facility and a CCRMC and the specialty providers. And so this week we were able to have our utilization management manager and our specialist medical director review the workflows, and with this we were able to establish a direct line with our utilization manager, so hopefully this will facilitate the authorization.
Good morning. How are you guys doing? My name is Fatmata Longstreth. I work at the Martinez Detention Facility, and I'm the charge nurse for the day shift. I was part of the transportation, scheduling and transportation group for this week. We identified that our senior clerk have many roles which impact her ability to fully focus on scheduling specialty appointments into a complex system. Some of the ideas we came up with will be to establish more clerical staff to assist her with workloads so that she's able to solely focus on our complex scheduling referrals, on our complex specialty referrals scheduling. We also identify that our patients may refuse one time or multiple times specialty appointment. And this create a flaw in the workflow. So we established, what we came up with is to establish a workflow that will deal with first-time refusals and multiple refusals. Being involved in these rapid improvement is going to be my third one. This process has truly heightened my awareness on our various processes within our organization. Not only that, it has also allowed me to see how our patient population perceive us on how we deliver care for them in our organization. Thank you very much.
My name is Elena O'Mary, and I'm the Nurse Program Manager for Detention Nursing. And I work with scheduling and transportation team. One of the problems that we identified while working on our team was the last-minute addition of urgent appointments. It created a lot of impact, not only on the patients, but also on the multiple disciplines that work in detention, namely custody, medical, including providers, nurses, and clerks. Our MD or provider would need to retriage the pre-scheduled list, sometimes resulting in bumping our patients who are on a routine appointments. So to make room for the urgent appointments, and due to the lack of, or insufficient resources, sometimes there's no available deputy to transport the additional appointment. It also strained custody's limited resources, though I would like to really thank Lieutenant Sanders, Lieutenant Andrews, Sergeant Lam, and Sergeant Baldwin for really working with us, in establishing an algorithm to avoid the friction and animosity that could arise from these situations. So we collaborated with custody, we defined our roles and expectations, all disciplines, and created an algorithm to enhance the escalation process and our communication pathway, thereby creating an environment of cooperation which is truly very necessary in the jail. Thank you.
Good morning, everyone. My name is LaShawn Haynes. I currently work at the Martinez Detention Facility as a senior clerk. And this week, I was working with the scheduling and transportation team, and I was able to, along with Sergeant Lum, to collaborate with the access and capacity team to help orchestrate and coordinate the logistics for the impacted specialty clinic of optometry and ophthalmology. By doing so, we will go from scheduling 4 patients per month to at least scheduling 20 patients per month into these clinics. This should result in a very positive outcome as we will be reducing scheduling wait times in an already impacted specialty clinic and providing our patients with the care that they need and deserve.
Good morning. My name is Nikita Hughes-Williams, and I work in the appointment unit for hospitals and clinics. One of the processes that we looked at was the AVS, which is the after-visit summary, and this is a document that is given to every patient after their medical appointment. It summarizes what happened during the visit. The problem that we identified is that the AVS lists a patient inmate's future appointments, and they are not allowed to have this information due to safety concerns. Our idea was to customize an electronic health record for use in detention, which removes the appointments from the AVS when printed for patients that are in custody.
Excuse me. Good morning, everyone, and thank you for being with us here this morning. I am Deputy Bork. I am currently assigned to the mental health unit at the Martinez Detention Facility across the street. Over the past week, during the Rapid Improvement event, myself and my team behind me were focused on the groups that are being provided on M module at MDF. So a little background on where we focused our groups. We focused specifically on M module. This is a module that houses inmates that have specific medical and mental health needs. The mental health multidisciplinary team was created last July of 2017. Myself, 2 other deputies, various clinicians, medical and physician staff at the MDF are a part of this team as well. So for the first time, groups were provided on M module to the mental health inmates. One of the goals for the mental health staff to provide these groups were we wanted to give them information and tools that they can use as they transition back into the community. Number 2 is to reduce the recidivism rate of them coming back into custody. And number 3, to improve their coping skills, reduce stress, and promote their mental health before they leave the facility.
Once again, I'm Dr. Chris Farnatano, and I had the pleasure of being part of the group's team this week, and I really enjoyed working with our team because everyone on the team really was very willing and interested in testing lots of new and different things and trying whatever we could try to do to try to increase the frequency and the participation rate of our patients in groups. For instance, one of the things we tested was testing running a therapeutic group on our medical module in the evening. And we surveyed the patients, and we found that there was strong interest in doing groups in the evening. And then we planned a test on Tuesday night. Our clinician was not successful in running that test because we found that the clinician was kept being pulled away for urgent medical needs of assessing patients and urgent mental health crises. And so we took that information, so we did a plan, we did the test, we studied it, and we realized we needed to assign roles to the different clinicians so that the clinician who's on shift that night, who's not running groups, can be focused on handling all the urgent calls so that the clinician running groups is less likely to be pulled away for an urgent need.
Hi, I'm Mary Jacqueline, and I work at Health Services in the group visit program. And I walked away from this very productive week with a real admiration for the people who work in the detention system, and also the realization that the whole week was a testament to the power of groups. When you bring people together under the right circumstances, they work together, they support one another, and creative, positive change can happen. That's why we do groups in our health center, and that's why both mental health and custody are so supportive of doing more groups in the detention system. The reason we do groups is to benefit our patients. So one of the first things that we did was to go down to M module with Deputy Bork and to speak to some of the patients. Later on in the week, when we had additional questions, we went back down to M module and had the opportunity to talk to patients. We asked them what they liked about their current groups and what they wanted to see in the future.
Good morning, my name is Felicia Casados, and I work here at the Martinez Detention Facility as the mental health senior clerk. I was a part of the groups team, and here's some of the feedback and patient quotes, both positive and negative. Patients like the RAP group, which is the Wellness Recovery Action Plan, because of what is offered, such as writing and participation. 60-minute group length was asked for consistently. Yes, I like groups. I like to be around people. I don't like someone talking at me when they are not in my shoes. And one that really stood out for me was gets me out of my cell and out of myself. I would like to give a thanks to the RAP facilitator, Colleen Hasenpush, And I would also really like to say really quick is I really felt fortunate to be invited to be part of this event. Even though it was really overwhelming at first, I was really amazed to see and really excited to realize that the patient voice was and is just as important to everybody involved as it is to me. So thank you.
Good morning, everyone. My name is Linda Thomas. I work on the Blue Zone team for Contra Costa Health Services. And this week, the Therapeutic Groups team worked on the improvement idea of creating the mental health clinician specialist group schedule, which had not existed before this week. The goal was to increase the number of groups offered and the level of participation by patients by setting predictable times for groups so that patients can sign up beforehand. This week's Detention's mental health clinician Davina worked with Deputy Bork to create this schedule for clinician-led groups that will meet the goal of providing 10 hours of group programming per week for both males and females on M module. This PDSA will be tested next week, and there are already sign-up sheets on M module, thanks to Deputy Bork.
Good morning, my name is Davina Williams and I'm a mental health clinical specialist. This week I ran a group on depression and we had 4 male participants. The feedback was that they like groups, would like to have more groups, and that they would like the groups to be scheduled.
Good morning, I'm Candy Heinen, an RN in detention. In working with this group this week, we investigated the groups that are already ongoing and done in the jail. We found a long list of barriers to doing groups in this setting. What we found was that many of these barriers are far beyond the scope of a one-week improvement event, but we did find that documentation of the activity is something that we could take on. After completing the group activity, the mental health clinicians have to find a computer and then type a note on each individual participant. Since typing speed, composition, and thoughts are all vary among people, there was no standardization to the notes that were being done. There was also no standardization to how long it took them to do the notes. And there was sort of a built-in disincentive to have more people in your groups, because the more people you have, the more notes you had to type, and typing each one individually took a long, long time. So there was a need identified that the documentation process be much quicker. After an initial struggle, we developed a flow sheet that needs mostly quick clicks and very little typing. The other disadvantage of the old way, nothing was measurable, because once it's in a note, you can't pull it out. With the new flow sheet, each row is measurable, so we have something going forward. The quick clicks and very little typing we anticipate will considerably over time speed up the process of documentation. It will create individualized notes. The information included in the notes will be standardized, it'll be relevant, and it certainly will be measurably and quickly done. And that would hopefully encourage a higher number of participants in the group, or incentive to increase the number. With the help of our IT team, Tyler and Jai, thank you, Jai, we managed to have a usable document in the electronic medical record, and it's usable starting today, which is awesome. And even though we're still understaffed, it doesn't require more staff, which most of our things have.
Good morning. I'm Erica Jensen. I'm the assistant to the Health Services Director. I also work in the Blue Zone, which is our internal consulting group here at Contra Costa Health Services. And I was the workshop leader this week for this event. So I've already cried once this morning, so I'm just going to put it out there. This is how I roll. I feel very deeply about this work. So I'll talk more about the team. But at the end of the week, we asked the team to sort of reflect on what they learned and kind of how the process was for them this week. And we got consistent comments that it was a really productive group, that we did tangible, concrete things, that we were able to design new workflows, And also really that we had been thinking about these things for years, and they were so excited to actually do them. It was really, I think my role was really just unleashing the passion and the energy and making the connections for the people that already work in detention every day, both custody as well as health, medical and mental health. So it was a privilege to be in that role. I think the other piece that people really reflected on was that detention is part of a larger health system and actually part of a larger system in general here in the county. So I see many of you in the audience who don't actually work in detention, but enormously helped us this week. Certainly the data people, Bumil, John, Jennifer, Matt, everyone providing the data for us to be able to understand the problem and then be able to come up with solutions. The CC Link team, Maura and Jai, David Seidner as our mental health program chief, Yvonne Hollister as our utilization review manager, lots of people in the audience. We just called in a moment and everyone responded to our call. So I just want to say that that's part of the thrill of doing these, is connecting people in detention and taking them outside of detention to see what else happens in our system and bringing that back into detention. I also want to acknowledge Pam Peacock, who I met on Wednesday. We took our team over to the dental clinic to talk about dental operations. I met her for maybe an hour. I sent her an email that night and I said, hey, could you stop by detention on Thursday just to get us a little more information, because she knew a lot about how detention had worked. She was there all day Thursday and she came today and presented this morning. People are in for this. They are excited about this work, and this work is really making changes. I also wanted to say that we've had more custody participation in this rapid improvement event than we have had in the past in terms of team members with us every week. So we identified some people who are in the transportation unit, some people who are in charge of operations, and for the weeks before I would see them over at Martinez Detention Facility in the servery, and they would be like, do I have to be there all week? How much time do you really need me for? And I would just be like, yeah, if you could show up on Monday, that would be great. We have a little educational presentation we do, and then we're going to break into groups. And still, Monday morning, they were, I would say, reluctant to participate. They definitely showed up. They definitely were interested in addressing the problem. I had one of them say to me, this is going to take an hour, and we're going to fix this. And I said, great, I'm so happy you're here. And he came back every single day for the whole day. So I think that making that connection about sort of understanding the complexity of what happens both on the health side and on the custody side is really part of this event, and really part of the understanding of sort of how this system works together and how complex it is, and how much energy and passion and creativity and innovation is needed to be able to solve these problems, and they are solvable. The other thing I want to say is that everyone, as Felicia way more articulately could say than I did, that everyone on the team is committed to patients. They are committed to the people who are incarcerated. They are committed to helping people while they are incarcerated. They are committed to helping them so that people do not come into the jail facilities, and they are committed to helping people when they are released. And that commitment shines through every day for people who work in the jails, and every day and every moment for this week. So for me, that's why I do this work, is really to help people that all the rest of the systems had failed. Thank you, Jill Ray, for that quote. And this is our job. This is why we exist. Okay. I'll try to keep it a little lighter now. I did also want to say that Nikita brought this quote to me: to make a difference in someone's life, you don't have to be brilliant or rich or perfect, you just have to care. And that's partly what happened in this workshop and previous workshops. People come up with that desire to care, and they're willing to listen. So we did some big things in this workshop, right? We increased appointment availability. Can you imagine going to work every day feeling like there are patients there that need care that you cannot get that care for no matter how hard you try? There are 75 patients at West County waiting for dental services. I don't know if you've ever been in dental pain, but it's excruciating. And not all these people are in pain, but it is still a needed, clearly critical service that we must provide as a health system. And healthcare is constitutionally guaranteed for people who are incarcerated. So it is not only our moral obligation, but it is our legal obligation. LaShawn, Sergeant Lum, Elena designed ways to really improve the communication and the connection. Sergeant Lum, who couldn't be here today, I saw him on the way out when I was leaving the detention facility, maybe 7:30 last night. He was working later than I was. And I said, he'd been with us since 8 o'clock that morning. And I said, thank you so much for participating. And I said, I'm really glad. And he said, this is going to work. May not work the first time, we're going to test it, but this is going to work. And I'm so happy to know the people and know sort of how it works, know the health side so I can understand that. The other thing that Fatmata sort of touched on was our understanding of patient autonomy. So the issue around patient refusals, what happens when someone refuses medical care? When that medical care is linked to a really important diagnosis, or when they just don't want to go see our health staff that day. What do we do as both custody staff and health staff with that information? And I think as a healthcare professional, right, we want people to get the healthcare they deserve. This is what this is kind of our mission. And to really understand and respect and give patients who are incarcerated the autonomy that they have while they are incarcerated when so many of their other freedoms are taken away is a really important, critical piece. It's really about respecting the person in front of you and seeing the person in front of you as a person. And also managing your own anxiety, right? How can I help this person? And the best way sometimes to help people is to acknowledge what they want. I think the last thing I want to touch on is improving the documentation tools for clinicians. So Candy Heinen has worked in the jail for many years. She's tried to make improvements for many years. She was a change agent fellow at CCRMC, Contra Costa Regional Medical Center Health Centers, 2 years before I was, and I saw actually change agent fellow on an email she sent me, and I said, what is that? I want to do that. So she actually is the reason I'm in my position today, so I wanted to thank her publicly for that. But also she asked about 5 times, how can we do documentation so it's easier? How can we make these groups happen? If documentation is a barrier, let's get over it. And her persistence and her creativity over many years of working in the detention facility, I'm embarrassing her now, I can see, really is it's a privilege to work with her. The other thing I just want to mention is that improved documentation doesn't exist in the rest of our health centers. We do many, many groups throughout our health centers out in the community, and clinicians and staff have to document in a very cumbersome way. So the other thing that I think detention staff and detention as a whole can bring is information and resources to the larger health system. Detention is part of our larger health system, and we can share resources back and forth. So thank you. I wanted to just emphasize that we always think about dignity, privacy, and safety for staff, for patients, and that includes both custody staff as well as health staff, and also for families that are left behind when someone is incarcerated. So when it comes to human dignity, we cannot make compromises. I really felt like this week was really about dignity. Dignity with respecting people's choices, dignity with respecting people's workload, people's processes, people's perceptions, where they're coming from. And I couldn't be more happy and excited to go to the detention facility every day to work with such committed people on behalf of our whole community. I wanted to just shout out a few thank yous. So when we do this event, we take a lot of staff. And so I wanted to thank the staff that was still working while we were doing that. They were keeping the operation open 24/7 at both Martinez Detention Facility as well as West County Detention Facility. And that includes Sheriff's Office custody staff as well as health staff. I also want to thank our subject matter experts, many of whom are here in the room today, and if they can't be with us, like Tyler, our data person who came in and did anything we asked around data. We just really appreciate your help, and you have no idea how much it means, the information you bring, but just the support by being there. Of course, our sponsors, Anna Roth, the CEO of Contra Costa Regional Medical Centers, Health Centers, and Detention Health, as well as Assistant Sheriff Matthew Schuler. They both have supported this work unconditionally. Every time we ask for something, they both have stood beside us and behind us to give us that. This week I actually learned where Assistant Sheriff Schuler's office is. So now actually I just go directly there a couple times a week just to check in. So now I think I'm not sure he wanted me to know that, but now I do. So the other thing is the Leadership Support Advisory Team. So that team comes every day for a half an hour for us to discuss the work of the team and then to give us some information about what they see, what else could we do better, how can we improve, what do we still need to think about. So I wanted to particularly thank some people here in the audience, Barbara Serwin, the chair of the Mental Health Commission, Jill Ray with Candace Anderson's office, thank you, Anna Roth and Matt Schuler, Cam Baker from County Counsel's office, Lara Delaney from the County Administrator's Office. And in the back, Lieutenant Sanders, Captain Simmons. I think, am I forgetting anyone? There are other people who came Teresa Pasquini, I can't see you, but I know that you're here. So thank you all for supporting us and for supporting our work. And this is just the team. And I can't be more proud and privileged and full of joy to be doing this work. Thank you so much. And I'd like the team to stand up again. Can my team stand up and we can give them all a hand? And now it's my pleasure to introduce Assistant Sheriff Matt Schuler for a few words. You can put this higher.
It'll be very few words. Again, I am Matt Schuler. I'm the Assistant Sheriff in charge of our custody services here at the Sheriff's Office. I do have a complaint to start, though. Erica, all week, would come by my office and bring donuts. There is no way I'm getting this freshman 50 off without stopping those donuts. Vegetables. You got to bring those by my office. I know. No, definitely. No, on behalf of the Sheriff's Office and Sheriff David Livingston, we appreciate everybody's effort in what we're doing here. It's important that we're open to change and do whatever we can to make sure that our environment is conducive to getting better and working together with everybody involved. I'd also like to thank the folks from Health Services. Unbelievable job. They're very inviting and opening to our staff to make sure that we're working together and getting the best at everybody. All the community members, Jill, Barbara, Teresa, thank you for being there all the time. We really appreciate it. Your input is very, very important. And to the Sheriff's Office custody staff, thank you for your dedication and be willing to work through this process. So that's very important. The transportation to the specialty clinics is something that I have been working with for about 20 years. I was in the transportation unit 20 years ago, and we were having the same issues back then, the scheduling and getting people to and from their appointments on time without missing them canceling on us, those sort of things. There's a lot of moving parts on both sides. I think we've done a really good job of identifying what we need to do to make sure we get people to and from those appointments in a timely manner, without the friction, that we all work together with smiles and do it the right way. The groups on M module, it is important to have groups on our M module, but it's more important to have the right groups on M module, not just groups just to have groups, but the ones that will affect the outcomes and make sure these folks are getting the care that they need while they're in our custody, as well as a transition into our community and getting the care out there while they're there to make sure that they're not coming back to us, that they're staying out and being productive members in the community. So, there is a lot of room. It's clear that we, for improvement with communication and coordination, I think we're moving in the right direction with that. So Thank you again for everybody's dedication and time for to help us become better. So I'd like to introduce Anna Roth, and she will finish this up.
Thanks to everybody for being here. I know that these are long, hard weeks, and I just want to acknowledge, you know, I think like sometimes we do all of this work, and it's easy to sort of rush forward and not pause and celebrate and acknowledge. And for those of you who know me, you know that I like to keep score. So I like to keep data. And so I want to just talk a little bit about what this detention health team has accomplished. So in the, because when you stand up here, you make it look so easy, right? It seems like the group's just thinking, we did this, we blew through this, we've opened up specialty care. So let me tell you about, for the people who know, I think there's 3 things that you need to be when you lead change. One is you need to be bold. And we're going to talk about that in a second, but let me go through the 3. The second is you need to be brilliant. And finally, you need to be brave. And so I want to talk about what you guys have done. Being bold. You have set the aim for one level of care across this system. I love it. You have decided that nobody is going to get a different level of care, and that if you're out living in the city of Concord, Richmond, anywhere across our county, Danville, San Ramon, the kind of care you can access there, you should be able to access that if you're incarcerated. Okay, I love that you have sort of set the aim for one care, no compromise. Erica said no compromise. Erica, I love the way you roll, by the way. I really do. Oh, there you are. You talked about building an environment of cooperation. I don't think many would describe the detention service in that way prior to sort of coming here and seeing your rapid improvement events. I think that there are a lot of belief systems about what goes on in detention. There are a lot of values around that, and I love that you guys have sort of set this aim. There will be no compromise. So that takes a lot of vision to be that bold. The other thing I want to say is you set some aims and you held yourself to some hard standards. So we're going to talk a little bit about being brilliant now. Nikita said you don't have to be brilliant, you just have to care. But I want to just add, Nikita, you guys were brilliant. So they didn't say it, they didn't tell you, but at the end of every day at the Leadership Advisory, we heard this. The new clinic starts when? February 15th. So it's not like they set something for like next May or June or we'll try it in the fall. They're starting in 2 weeks with this new clinic. So I want to say that that's how you get stuff done, is you make an aim, you put a stake in the ground. And you guys did that. You went from, and I'm sorry I didn't write down which one, but you went from 4 appointments to 20 in dental. Is that in dental? Optometry, okay? That's a 5-fold increase, you guys, so you've got to stop and quantify that. Imagine if you could do that across the system, what that starts to equal in terms of outcomes for our patients, in terms for reducing suffering, needless suffering for our patients. And then you also reached across. You talked about streamlining. I was sitting with the homeless Housing and Homeless Chief, Lavana Martin, and she was looking at your charting for this group charting, and she whispered to me, I want that in the homeless division. You know, so you guys are starting to create tools that the rest of the system now can look to. You're creating examples for the rest of the system. You talked about, we talked about 1 hour at a time. Somebody said, the deputy said, we can get this done in an hour. I want to acknowledge the work that this team has done. So you've done 1 value stream mapping event and 3 rapid improvement events. Those are 40-hour events, about 20-hour staff. You know what that means? You have dedicated 3,200 hours of design hours to redesigning the detention services, and you're just getting started. So that is like brilliant. And you guys need acknowledgement for that. I want to acknowledge the Sheriff's Department for really releasing staff. And I know that the Sheriff's Office sort of stood back and thought, what is this stuff the hospital and health centers do, this lean and this improvement? And my favorite was when we told the Assistant Sheriff and the Sheriff's leadership that we do report outs and talk about defects publicly and then videotape them and place them on the web. That was super fun. But, you know, that's why I don't know where his office is. But it helps us as leaders. It takes us sort of to the next sort of, my next sort of point. So like lots of brilliance there, but to the next point is, which is be brave. And it's not easy to be the leader and listen to all of this change that's needed, all of these places where we're not hitting the mark, where we're not doing what we want to be doing. It's hard to listen to, so I want to acknowledge and recognize the Sheriff's Office for having the courage to take this journey with us. I want to recognize and acknowledge the staff for having the courage to try something different, especially in an environment where I think we believe things have to really remain constant and stable, or there's a possibility we'll be compromising safety. So I want to acknowledge that. I know that there has to be a lot of thinking about it. There has to be a lot of creativity. And I haven't, you know, I don't see you guys backing off at all. I really, really admire the kinds of reaching across the aisle, reaching outside of your own notions and testing something new. I also want to thank the leadership advisory team. They get in their car and they drive out to the jails. This week it was like, I feel like it gets dark now at like 4:30 or something. Every night we're walking out, it's pouring rain this week, and we're out in the parking lot, but they come from all over the county. Every day at 4:30, we kind of cross paths with the improvement team. As you're walking out, we're walking in. But they bring really good ideas, and we can't lead this change without the community helping us and advising us. And I think that's another sort of new phenomena for the Sheriff's Office and even for health. We are learning to be better partners with the community and learning to take your input. And even though sometimes we don't, we seem to move forward, when you stop us and you say, hey, what about this? I hope that you're seeing that we consider it, we think about it, the next day we come back, and what we find is at the end of the second day, the next day, the team actually tested some of those ideas. So I just want to thank everybody for your continued work. This isn't easy work. I want to leave us with Sergeant Lum's quote, which is, "This is gonna work." Thank you so much.
In the spirit of improvement, we have our next rapid improvement event already scheduled and the topic. So this has been my thing. Let's figure out what we're going to do. So I'm calling out Dante, Patrice, Christine to be on that team with us in March. So be looking for emails, be thinking about things we can improve. We already tested Tiambe, and Deputy Bork actually already tested some pre-release screening that happened in intake, and now we're going to expand that. And Maybell, tell your people we're coming to West County. So thank you all for being here. It really means a lot to us. It really means a lot to our community. Thank you. We'll see you on March 23rd. And the team is around for questions or accolades.